Over last few years, I think since, about 2015-16 onwards, there have been many studies which have been published, but these studies mainly come from, four countries in the low middle income countries in Southeast Asia. That's India, Pakistan, some from Bangladesh, Iran, and a large body of evidence comes from China. Right. So these are four or five countries from where all the literature about thalidomide is being published. There are multiple papers. A lot of them are actually just prospective single arm trials. There is no head, except for two studies, there is no head to head comparison with a placebo or the standard of care treatment, like your regular transfusion chelation. And the population that has been studied in these uh, trials have been very variable. Some of the studies had only transfusion dependent, the other had a combination of transfusion dependent and non-transfusion dependent thalassemia. The age group is very varying. The endpoints, the response criteria have been very different. So it's very difficult to put all of this together. But most studies have shown that it helps in improving hemoglobin by actually increasing HbF, because the increase in HB correlated with, or was proportional to the increase in HbF. A lot of studies are mainly concentrated on adults, but few studies from Pakistan and from India have looked at children, which remains a concern right now because of safety measures. So considering there are more than 20 papers right now which talk of thalidomide and thalassemia, and they've shown that it increases hemoglobin, it reduces transfusion requirement, but safety is something which I believe, none of these papers have looked at it the way it should have been, considering our past experience or not so good experience with thalidomide in the past, right? And that's why the drug was not being used for so many years, right? And so yes, it is efficacious, agree with that, but safety is something that we need to look at, especially in thalassemia, because it's not going to be a short term use. It's not something that you're going to use for 1 year or 2 years. It's going to be used lifelong. So long term safety remains a concern, and especially if we're using it in a very young child. So we need to have certain parameters or certain long term studies before we can call it safe for use in thalassemia, and more so in pediatric patients with thalassemia.